I'm Karen Keiser, a retired Washington State Senator. I served in the Washington State Legislature for almost 30 years, many of them as chair of the Senate Healthcare Committee, and I have been an advocate for healthcare for all in all of those years. And now Healthcare for All is an organization that's fighting for healthcare for all in our entire state that I hope you will support. HCFA means everybody in, nobody out. That's what we need. Our healthcare system is a mess, and these are really troubling times. I currently serve on the healthcare exchange, and we are facing the end of the premium tax credits, which will make unaffordable basic health plans for some 80 to 100,000 people in Washington who are on the exchange and getting health insurance now with the premium tax credits. But they will not be able to afford the increase in premiums if those federal tax credits go away, which is what's happening right now. We're facing a deadline, and I'm really, really sad that at this point in time, we are facing a reduction in health insurance coverage. What we need is health care for all. And we need to work for that because there's no other way around it. That's the most efficient and the best approach.
My name is Vinny DeMarco. I'm the president of the Maryland Healthcare for All Coalition. And you just heard from Ryan Moran, who is wonderful, and you stole him from us, fair and square. But I'll tell you, in the state of Maryland, he was doing a great job as the Deputy Secretary for Medicaid in our state, and I loved working with him. And when I heard he was leaving, I was livid. I said, Ryan, what are you doing? And then I heard he was going to Washington. There's a great new job there, and that he would be in charge of the Prescription Drug Affordability Board in Washington. So I became a little less upset. And I'm thrilled he's with you, and you heard his great remarks. He's going to be terrific with you. I also loved coming out there and meeting with Ronnie Shore and your team. You have a great organization out there that has done so very, very much. And we are so happy to be also a healthcare for all group here in Maryland. And like you, we believe that everybody's in, nobody's out, and that everybody needs quality, affordable healthcare. And you can make a difference by contributing to your Healthcare for All coalition because what they do is incredible. Only 4 states in the nation have prescription drug affordability boards that can put upper payment limits while people pay for high cost drugs. Maryland, which was the first, followed quickly by Colorado, Washington, and Minnesota. We're the 4 national leaders. So your group needs your support to be able to support the board and do more. And together, we'll all work together to make quality, affordable healthcare affordable and available to all Washingtonians and all Americans.
Hello, everyone. I am My-Linh Thai, State Representative from the 41st District in Washington State. We are so lucky to have people like you in the room supporting healthcare for all, where everybody's in and nobody's out. This should be the direction for us, for the healthcare system that we all deserve. I ask you to continue to support Healthcare for All because when we are successful at the task of universal healthcare, we all benefit from it. I thank you and I wish you the best night.
Hello, this is State Senator Marcus Riccelli from the 3rd Legislative District in Spokane. And I often enjoy agreeing with people on my side, the east side of the state, but the west side's pretty great too, especially when we have people fighting for healthcare for all. And Healthcare for All Washington is an important organization that is ensuring that what I believe is carried through and what so many do, that healthcare is a human right. Please continue to support this organization. Organize, mobilize, and open eyes. Everybody in, nobody left out in any corner of our state.
Hello, I'm Rabbi Dana Benson, and I'm here because I support the human right to healthcare for me and for everyone. In this moment in time, we find ourselves divided and taking care of only ourselves or ensuring that we are continuing to take care of others. And in this moment, your support, your volunteering means more than ever to make sure that we can support not just the vision, the hope, but the reality potentially of healthcare for all. When I think about the concept of what it means to have support for all people, I think of the quote from Pirkei Avot that Rabbi Hillel famously said, "If I am only for myself, what am I? And if not now, when?" Everybody is in, and that is the work we need to do, is to make sure that everyone feels the support of knowing they are in and that nobody is out. Through your care, through your time, through your actions, and even through sharing your words, you can help to make sure that healthcare is truly for all. If not now and when, if not us.